So here we go. These are the ligaments we talk about. If it's from the coracoid to the clavicle, coracoclavicular. If it's from the coracoid to the acromion, coracocromial. If it was, so you know, you guys can do that. Same thing. Elbow joint. Same thing. I'm not really going to test on ligaments, but the 300 level will test on ligaments. Humeral ulnar joint. Humeral radial joint is a minor connection, but how I remember this, and we did the bones, we said the capitulum sits on the head of the radius, and the trochlea of the humerus connects to the ulna of the ulna. Supporting elbow structures, you guys can look at this. Annular just means wraps around. So annular ligament wraps around the radius and allows for the pivoting and rotation of the radius within the annular ligament. That allows you to do this. Supination, pronation, supination, pronation. That's all that it does. And then what else do we have? We have more articulating connectors. If you're doing the 300 level, just look at where it is. What part of the bone to what part of the bone. If this is from the ulna to the humerus, or it's just, she's just grouping it generally. Collateral means a group alongside. So ulnar collateral ligaments. Hip joint. Again, I'm still not going to test you on it, but I want you to recognize, because if I have test questions that have these words, you need to know where they're going from and where they're going to. Iliofemoral is from the ilium, iliac bone, to the femur. Pubofemoral, pubic bone to the femur. Ischiofemoral, ischial bone or ischial bone to the femur. Acetabulum in the center, connection point between all three bones. So iliofemoral, ischiofemoral, and pubofemoral. Okay, knee joint. Same thing. The only thing I ask that you remember is this. For the knee joint, it has a couple of, the reason why you should know this, especially if you're going to athletics, is they make clipping illegal. Clipping is when you basically hit the person from behind the knee. And what that does is there's ligaments that hold the knee in place, right? The knee is not stuck in some kind of socket. It's actually sitting just on a plateau. So the only way that I'm going to be able to keep it in place is by securing it with rope. So I have rope on the inside, I have rope on the outside. And that's all that I have to secure the knee. If I tear the rope, I mess up the knee, I can't walk. You're probably going to have to go in for surgery or something. So I have, if you take your fingers and you do this, and then you cross the middle finger over the index, and you place so let's do this. I place the middle finger in front and I put the index in back. Which one is touching the front? The one that's anterior touches the front. The one that's posterior touches the back. So they cross. The word for cross is cruciate. So cruciate is cross.